Welcome to the MediByte channel. I'm your host, and today we're tackling a topic that honestly can be incredibly frightening for expecting parents. But it is absolutely crucial to understand: vaginal bleeding during late pregnancy. As a healthcare professional from MediByte, I really want to reassure you right off the bat that we're going to break this all down in a complete, detailed, and super easy to understand way. Because, knowledge is power, and knowing exactly what's happening and when to seek help, that is your very best tool.
Okay, let's dive into this. Here is our roadmap for today's explainer. We're going to cover understanding late pregnancy bleeding, the most common cause, serious bleeding causes, warning signs, the medical evaluation, and wrap it all up with treatments and takeaways.
Section 1. Understanding late pregnancy bleeding.
So any vaginal bleeding that occurs late in pregnancy, and medically speaking that means anytime after 20 weeks, it requires a prompt evaluation. Why? Well, because while it might be totally harmless, it can also be tied to complications that could affect the safety of the mother or the baby. But hey, before we get into the heavy stuff, I want you to take a deep breath. Know that only 3 to 4% of women actually experience this. It's relatively uncommon, right? But it's common enough that it's a very well-recognized symptom. If it happens to you, you're part of that 3 to 4%, and the medical community knows exactly how to handle it.
Section 2. The most common cause. Now, what's really interesting about this slide is that this most common cause isn't actually a complication at all. It's known as the bloody show or losing the mucus plug. Think of the mucus plug as a sticky, small ball of mucus in the cervix, often with little streaks of blood. When the cervix starts to open or dilate to get ready for labor, these tiny veins tear, and that results in a small discharge of blood mixed with mucus. Losing this plug? Not a medical emergency. It's usually just your body's natural way of signaling that labor is likely going to kick off within the next week. Section 3. Serious bleeding causes explained. And this brilliantly illustrates what happens when bleeding isn't just the start of labor. What are we looking at? Well, placental abruption makes up about 30% of these cases, making it the most common life-threatening cause. Next up is placenta previa, coming in at approximately 20%. The remaining 50%? That's made up of various rare causes or disorders completely unrelated to pregnancy. Let's zoom in a bit closer on those two major conditions. Let's put placenta previa and placental abruption side by side. In placenta previa, the placenta is sitting abnormally low in the uterus, and it partly or completely blocks the cervix. The absolute hallmark symptom here is painless vaginal bleeding. No pain, just bleeding. On the flip side, placental abruption happens when the placenta detaches from the uterus way too early. This one is typically characterized by pain or tenderness when the uterus is touched, and the blood might look dark or clotted. Doctors actually use that presence or absence of pain as a quick frontline diagnostic tool to figure out what's going on inside. Now, beyond those two, there are some very rare but severe conditions like vasa previa and uterine rupture. Vasa previa is when the fetus's own blood vessels actually grow across the cervix, blocking the exit. If these tiny vessels tear during labor, the fetus loses blood, and that is incredibly dangerous given their super small blood volume. Then there's uterine rupture, which is exactly what it sounds like, a literal tear in the uterus. This almost always occurs in women who already have scar tissue from a previous surgery, like a C-section. Both of these present severe risks during labor and mean you absolutely need immediate medical intervention. Section 4. Warning signs and risks. Listen closely here. You need to head to the hospital immediately if your bleeding is accompanied by fainting, lightheadedness, or a rapid heart rate. These are classic signs of very low blood pressure and severe blood loss. Also, a tense, tender uterus or labor contractions that just suddenly stop, those are massive red flags for fetal distress or uterine complications. However, and I want to be perfectly clear about this, if you only have a tiny amount of mucousy blood and you suspect it's just that bloody show we talked about, call your doctor first. They are the best ones to tell you exactly when it's time to come in. It's also so vital to understand your own personal risk. Key factors that elevate your chances of experiencing these serious bleeding disorders include a previous cesarean delivery, high blood pressure, being over age 35, having multiple previous pregnancies, or cigarette smoking. If literally any of these apply to you, don't panic, but know that your care team is probably going to be monitoring you especially closely during that third trimester. Let's move to and see how this builds into Section 5, medical evaluation and testing. Okay, so what actually happens when you arrive at the hospital? The clinical care progresses in a very specific step-by-step manner. First off, they're going to ask you detailed questions about your history and the bleeding itself. How long it's lasted, what color it is, if you have any pain. Second, they immediately check your vital signs just to make sure you aren't experiencing dangerous blood loss.
Third, they start fetal heart rate monitoring to keep a continuous eye on the baby's status. And fourth, they'll do an ultrasound. This highly structured approach is exactly what allows doctors to rule out the most dangerous causes quickly and safely. So the crucial point is right here with our empowerment check. Normally, when delivery is right around the corner, doctors might do a digital cervical exam with a gloved hand to see if you're dilating. But if you are bleeding, an ultrasound absolutely must be done first to check for placenta previa or vasa previa. If either of those conditions is present, a digital exam can actually make the bleeding worse. If you already know you have one of these conditions, empower yourself. Remind your clinicians of your diagnosis and advocate for yourself by refusing a digital cervical exam until that ultrasound is totally finished.
Section 6. Treatment and final takeaways. When it comes to treatment, it generally falls into two main pathways. If the bleeding is serious, but you and the baby are currently healthy and you aren't near full term, the pathway is observation. You'll likely be admitted to the hospital so both of you can be watched like a hawk. However, if the bleeding continues, or if it worsens, or hey, if your pregnancy is near term anyway, the action shifts to immediate delivery. Depending on the exact cause, this could be a vaginal delivery or a C-section. And of course, if a mom has lost a substantial amount of blood, doctors are right there to administer IV fluids or blood transfusions to stabilize her. Keep this incredibly reassuring quote from our medical source material in the back of your mind. The severity of the bleeding does not always indicate the seriousness of the cause. Honestly, what this means is that seeing a lot of blood doesn't automatically mean the absolute worst-case scenario is happening. However, it does mean you should always get evaluated by a professional to be absolutely sure. Take it seriously, for sure, but try your very best not to panic. As we wrap up today's explainer, remember that your body is incredibly communicative during pregnancy. Listening to it and knowing when to ask a professional to translate its signals, well, that's the ultimate act of care. So ask yourself, do you know exactly what your body is trying to tell you today? If you found this explainer helpful in understanding those vital signals, please like, share, and subscribe to the MediByte channel. We are so dedicated to bringing you clear, factual, and empowering medical explanations. Thank you so much for learning with us today, and take great care of yourselves.